Welcome to Hero of Health. You might have noticed that the name has changed, and that's exactly because of people like who we are interviewing today. Because doctors and patients are now coming together to become the heroes of their own health and empowering the patients to become the heroes of their communities to be able to live a long and fulfilling life. Here we talk about chronic diseases such as type 2 diabetes, heart disease, including hypertension, high cholesterol, and even some lifestyle cancers such as breast, prostate, and bowel cancer, and how we can prevent and treat these diseases with lifestyle medicine. Now, we are here every single Sunday at 5 p.m. UK time. You can join us here on Zoom Live, so you can chat with us for the first 60 minutes and followed by a non-recorded period, or you can actually watch us on YouTube live stream as you are there right now. If you are, then please click the subscribe button and share our videos with your loved ones so that they can get the most evidence-based, up-to-date information on health. It's so lovely to see so many familiar faces joining us once again. Today, we are having somebody very special I personally really wanted to speak to for a long time, as he's a hero of health and the health system, in my opinion, changing it from a sick care. Now, Dr. Saul Bautista, we are going to talk about sick care to healthcare and how we can achieve it globally rather than just nationally. Welcome, and I hope that you are having a great time on your side. So a little bit of a short bio. Dr. Saul Bautista is an MD in America, is a family medicine resident from Newark, New Jersey. In the midst of 2 wars, he opened a Forgo College and enlisted in the U.S. Army in 2004. His experience working with wounded soldiers at Lanchel Regional Medical Center is what inspired him to pursue medicine. Upon his return from military service, he went on to attain a bachelor's degree in biology from Rutgers University in Newark. As an undergraduate, Saul witnessed how social factors, poverty, education, food insecurity, and transportation and housing impacted the health of people in his community. He felt compelled to explore solutions beyond the boundaries of the clinical setting. As a first-year medical student, he founded the NGMS Lifestyle Medicine Group, where he oversaw the implementation of numerous student fitness programs and community-engaged health education, health promotion initiatives. He was featured in the documentary film Code Blue, Redefining the Practice of Medicine, which presents the clinical practice of lifestyle medicine as a solution to the chronic illness epidemic. Saul believes that medicine can be used as a vehicle for social change. His vision is to build a healthcare system that mitigates and prevents chronic disease by empowering people with the skills needed to be active stewards of their health, and constructing communities that foster a culture of health by addressing lifestyle and social determinants of health. So welcome, Saul. Thank you so much for joining us today.
Linda, thank you for having me. And by the way, I love the heroes of health and just the collaboration between patient and physician, because really that's what I think is the future is going to be. I used to think it had to be top down or physician led, but it's really going to be a partnership between people and the general public, and really being out there in the community and physicians and just working side by side. I really think that's what it's going to take. And I love that you guys are taking the charge and doing it here in real time. So thank you, and thanks for having me.
That's exactly it. We have to start working together with our patients, not top down, no longer patriarchal approach, but really 50-50 equal ground where both voices are heard and we can navigate together to better health. So it's wonderful to have you on with us. My first question will be, what is it that really got you into medicine? Could you share with us that one moment when you were in the army that sparked you, that story to start?
Well, for me, I I think it all started in what we call high school, which is before university here in the United States. And I always liked science, particularly biology and the human body, but I also liked helping people. And so when thinking about a career that would merge both those interests, medicine naturally is a field that does both. And so, but at the time, I didn't think I was that smart. And it wasn't until I joined the military and I worked in a trauma hospital overseas, and I got to see the incredible work that was done by physician-led teams taking these wounded soldiers from Iraq and Afghanistan. I mean, they would survive traumatic injuries from Iraq and Afghanistan and be able to make it to Germany. And I remember seeing this one patient, I mean, from the waist down, his legs were gone. Half his arm was gone. Half his body was burned. And I just said, how on earth did you even make it here? And so really for me, I just appreciated just the incredible work that physicians could do. And I wanted to be able to do that for someone someday. And so that is sort of what sparked for me that medicine was a career worthwhile pursuing.
It's very empowering, that moment, really, when you see that in action. And the power of medicine, as we know, conventional medicine. I would love to talk to you about the definition a little bit, about what you saw then and what inspired you to go into conventional medicine as we know it, which is actually the surgical, pharmaceutical aspects. And the third aspect that we always know, the non-pharmaceutical aspect of medicine, that I kind of feel is what we kind of rebranded now as the lifestyle medicine. What do you think about that?
So I think traditionally the tools that were at our disposal, I think early on, really were one, surgical. There was an anatomical problem, and so you had to create an anatomical solution. And so you would excise something, you would alter something, and I think there was a lot of excitement, in, at least for us, 1600s, 1700s, and in exploring that. Sort of by chance, we started to look at chemical compounds and how that altered our physiology, and just discoveries along the way. And so people early on realized that, hey, we can actually help people with chemistry. And so again, I think a lot of these interventions were really driven by altruism, people authentically trying to help other people. What we didn't realize was that there was going to be an unintended consequence. And those are the two tools that historically we have used, we know them very well. And so it's like, okay, this is what I know how to use. I'm going to keep using it because this is all I know how to use. But now we've come to a point where we're starting to realize that, yes, these tools are great, but they don't do everything. And it's like, is there something else that we can use that is perhaps a little bit more effective for specific things? And I think in the last 20 to 30 years, physicians have started to realize that we've come to the limitations of the tools that we've had that work well for certain things. And now we're starting to realize, wait, if we start to modify lifestyle, we can solve some of these problems. And A, it's now knowing that we can use this as a tool. And then B, it's refining how well we use this tool. And I think that's where we are with lifestyle medicine. It's doctors need to know that this tool exists. And then we have to know how to use it and use it well. And I think that's where we are, is refining how well we use this tool.
And in your definition, what is lifestyle medicine?
So lifestyle medicine is the use of structured exercise, a predominantly whole food, plant-based eating pattern, social connection, restorative sleep, mitigating toxic substances like smoke, like tobacco, drugs, really, and modifying those factors to either prevent, treat, and in a lot of cases, reverse specific chronic diseases.
And which chronic diseases are we talking about?
So those would be more so like non-communicable diseases, like hypertension, diabetes, certain aspects of heart disease, select autoimmune diseases. For example, we know that for multiple sclerosis, lifestyle can be pretty effective. My mentor, Dr. Sarai Sansik, is a prime example of that. And I think over time, as we get a better understanding of the underlying physiology behind lifestyle change, we'll be able to apply lifestyle medicine to probably broader cases and probably more diseases. I think we're limited by our understanding of how it exactly does exercise work to mitigate autoimmune disease or mitigate cancer. We're sort of in our nascency in terms of understanding the underlying physiology, but I think as we get to understand that more, we'll be able to apply it more.
And how is it used in America right now within the structures that you have available?
I would say it's rather limited. I think that it's starting to be applied more. And again, sort of like we've talked about, part of the problem is that physicians, for the most part, don't know how to practice lifestyle medicine. And then the younger generation isn't really being taught lifestyle medicine because it's not integrated into mainstream education. But I do think, like I mentioned to you earlier, it's an exciting time because relative to when we started, I became aware of lifestyle medicine back in 2014 when I was a graduate student. And the transformation in terms of just the growth and the amount of people that are aware, number of physicians that are practicing, number of medical students that are interested, I mean, it's grown exponentially. And so, but I still think at the rate we're going, we're still about 20 to 30 years behind where we should be in terms of it being completely integrated and part of the healthcare system.
Which we talked about looking at the positive and that it is a very exciting time and we need to keep that energy to be able to push forward against all the odds. But we also have to recognize, I think, what drives me in emergency medicine is that there's an urgency like never before, where when one of my patients comes in emergency care, comes in with cardiac syncope episodes, 1 o'clock in the morning, and then he's informed by me at 1 o'clock in the morning that actually we could do something about this. And his 10-year-long, fatty liver disease, as well as his type 2 diabetes, his high cholesterol and hypertension could be addressed. And actually, to some extent, not only help his symptoms, but reverse to the point where we can get him off of his medications, is a moment in somebody's life that can redefine the next 20 years of his retirement, to the point where we can now course his life to having a Q-score where he might die in the next 5 years from a heart attack, or he's going to live the next 20 years slimmer, healthier, with less drugs on. So I think that urgency is what pushes me in not so much of a negative way, but with that kind of, we need to do this as much as we can, as big scale as we can. And I guess this is why we are here every single Sunday. What do you think about that urgency and that burning feeling in the tummy when you know that you can do something for someone, but it's very limited due to the systems within which we practice?
It's incredibly frustrating. And I think that you all sort of feel the same frustration that I feel. And I think that's what's been particularly challenging for me now in this part of my training as what you all would call a registrar in general practice. I would be on the inpatient service in the hospital and a patient would come in, they have heart failure, high blood pressure, chronic kidney disease, diabetes, and they're coming in with a heart failure exacerbation, and their blood sugar is through the roof, and their blood pressure is uncontrolled. and they're suffering. And that's the sense of urgency that you mentioned, is that you see a human being suffering that doesn't have to. It's like, how many people, if you were to walk by and you see someone drowning, you would just continue walking? I think that would be pretty agonizing to see someone suffering, drowning, and for you not to do anything. Or even worse, that there's a life raft right there and that you can use it, but there's limiting factors in you using it. It's pretty agonizing to see that. And then ultimately to see that.
Yes. I absolutely love that. I love that analogy. Walking by somebody who is drowning and you know that you could pick him out of the water, but actually your arms are totally tied and you cannot do anything about it. That feeling is definitely one that we live every day in emergency medicine, particularly because that's where we see the acute presentations of those chronic diseases, which have been building up for the last 30 years, knowing too well that we could have done something the last 30 years. So it really is frustrating, but it is, as you say, it is hopeful, because we just started having lifestyle medicine in the UK now for the first maybe couple of years, more systematically through the British Society of Lifestyle Medicine. And you guys have had it more than actually, when was the American College of Lifestyle Medicine started?
It actually started in 2004, believe it or not. So it's been around for about 18 years, but it was very small. I mean, probably for the first 7 to 8 years, I mean, the meetings were pretty small, maybe 50, 60 people got together. But over time, I mean, I remember when I was there in I would say 2015, there were about 600 to 700 people. And I mean, now year after year, it's thousands. And so, again, it's a very hopeful and exciting time, because I think people are starting to become aware and wake up to this. And more importantly, healthcare providers as a whole. Tell me about the British Society for Lifestyle Medicine, because let me tell you, as here in the US, as a young graduate student and early medical student, to see these international societies like sort of rise up, and also like, hey, it's not just us here in the States, but folks in the UK think it's important. Our colleagues in the Philippines think it's important. Our colleagues in India and in Asia think it's important. It's extremely validating and motivating to see, our colleagues around the world say, hey, we're excited about this. This is important. And so, but tell me the evolution in the UK.
I think this is amazing what you just point out, that before even though medicine is such patient-centered practice, every patient around the world, we're all the same basically as a human, right? And we are treating the human, the physiology, the pathophysiology. I mean, I studied from American textbooks, and most of us do, Elsevier, so and so. But in the end, we are so segregated from each other. And through lifestyle medicine, I feel finally we are a family of doctors who can communicate with each other. And that is really exciting. I think the fact that we can have this conversation and not have a system between us is revolutionary already by itself, right?
Oh, yeah, absolutely. And I think that's going to be really important for us to continue to communicate. I mean, just that conversation I had with Dr. Erica Lynn, it was so insightful for me, because kind of like I mentioned to you earlier, here in the United States, everyone thinks that, hey, if we have a nationalized healthcare system like the NHS, our problems will be solved, like things will be so much better. And lo and behold, that exists there. And yet there's a different set of problems that limit sort of the application of lifestyle medicine and preventative care. And sort of like I mentioned to you earlier, if we're going to create a solution, we need to account for those things. And I think here in the US, again, had I not had that conversation with Dr. Erica, I wouldn't have known that. And sort of that changed my thinking, because now as I'm creating a solution here in the US, I'm taking that factor into account for that.
Okay, how amazing is that? I mean, having had the conversation with Erica across the pond, we never met. And as doctors, we are bringing our minds together and we are really empowering each other to be better for our patients. I think this is the very first time in 10 plus years of medicine that I've been practicing that I can feel that as a force, we can really make a difference. And without the systems in place, because lifestyle medicine is such a tool that you can really use. It's information, really purely information, without the drugs, without the surgery, on as an addition to all of those things, of course, but it's information that can transcend all of these boundaries and barriers between us.
And you know, at the beginning of the interview, you had mentioned, hey, we are all together, sort of patients, physicians, we're all trying to be heroes for health. And part of this conversation today, and I think the purpose of this conversation today is how do we provide value for your audience in discussing, we are currently in a sick care system, how do we move towards a healthcare system? And I think, and sort of I've been exploring the idea that ultimately it's going to require sort of communities and people really taking it upon themselves along and partnering with the physician. I think the physician has to be an active participant and member of the community. You can't be there as sort of like an authority figure, sort of asking the community or imposing upon the community to take upon a solution. Now, it's a matter of the physician being a part of that community, seeing what's unique to that community, and create and help, and just using that knowledge and information to help the community care for themselves. And really, I really think that's what it's going to take. It's sort of all of us in a set place contributing and building a culture of health. And what I like to call in the United States, a health promoting economy. And I'll sort of expand upon it a little bit later, but that's one of the limiting factors for us here in the United States is that healthcare ultimately is subjective to the same economic pressures as any other industry. And really, you know, taking care of patients as a primary care physician, you got to see 20 to 25 patients to generate revenue. That's what it boils down to. If not, the lights don't stay on and you can't keep practicing. And so physicians aren't driven by money, but but when you're employed, when your employer, which is big healthcare, they're going to say, hey, you don't have control over your schedule as a physician. You have to see 20 to 25, and that's the standard. And that's what it is. But ultimately, sort of like we talked about, I think the solution is going to be really physicians, being courageous enough to move away and really become community-based and be part of the community. And that's who they should be accountable to, rather than a large system.
There are two cool things that you brought up. One of them is the system, the difference between the healthcare that we provide here in the NHS, which is free of charge to the end user. And you mentioned in the beginning of the interview that actually, whilst it's not commerce driven, it is actually the opposite. It's that we don't have enough physicians to deliver that care, which is actually results in the same problem. Our patients are not getting the care that they need. And I love that you highlighted that from the conversation, that no matter what, we have to find a new way, because neither the money and neither the number game delivery of the care is going to work. We are going to have to start with our communities and delivering that outside of the system. And this is how I see lifestyle medicine, very much so a community-driven pillar of medicine, where we bring the information to our community. And I would love to show, if you don't mind, show a little bit of our success that we have been doing, again, like everything free of charge here at Hero of Health. We have been able to kind of do that with one of the GP practices, where we have been delivering for the last 6 months a walk session, hero walk sessions for the patients where the GPs are referring into. And this is one of the pictures, if I can show it for a second, So this is a walk that we have every single Wednesday, and our patients come and they share their stories. And for the first time, we are able to break those mental health barriers that are stopping them from actually changing those lifestyle pillars, right? For example, Stephen, he's very open with his story, have shared how he was so scared to come to this group because, you know, he has been suffering from depression, and he just didn't have the means of communicating about his problems. So he gained weight, he felt overwhelmed by life because of a life-changing diagnosis, and he lost his job. And coming on these walks was the first time when he was able to open up and break that barrier and start changing his health. David down here, he has also been a big advocate of the group because he has been able to go back to work after the walks have started. After just 3 months, he lost 17 kilos, he addressed his diabetes and feels better than ever. We have many, many more stories, but I just want to show you the point that you have made, that we cannot get to the lifestyle pillars as long as our communities and our mental health is not addressed, I believe.
Oh, and I love that example because here in the US, we have something very similar. There's a cardiologist.
I think we lost Saul for a moment.
Oh. Hello? Hello?
Yeah.
Oh, hey, okay. I was just saying that
Sorry, there was a little bit of an internet problem.
I was just saying that I love that, and that actually reminds me of something that we have here in the U.S. There was a cardiologist that he started something similar called Walk with the Doc, and it's exactly to your point. It's about those pillars. It's this getting people together. One, because social connection is very powerful. When you have someone, it's easier to go through something that you're struggling with when you meet someone that says, oh, hey, I was struggling with that too. And for a lot of patients, it's really empowering when they meet someone that was struggling with the same thing that they were struggling with, and they were able to overcome it. And it's sort of inspiring. It's like, wait, I could do it too. Or if it's just with the physician, to know that your physician cares enough, and that you're there just sharing a conversation, being in nature, sharing a nice stroll, and that you're able to connect with your physician in an authentic way. That's really powerful for patients. And I think ultimately that's what patients want. And I can tell you here in the US, one of the common complaints that I hear is that patients feel like they're a number, like they're just being rushed through an assembly line, and that the person that's supposed to be caring for them, they don't feel that that person even cares about them. And ultimately, if you're trusting someone with your body, you want to at least know who they are. And that requires authentic human connection. At least that's the way I look at it. And so that's why I think it's very powerful for patients when they can go on a walk with their doctor and just have a conversation. That's part of it.
You are so right in that. You just pointed it out. What the big problem here in the UK is, all of our patients are always complaining that, oh, I don't know who's my physician anymore. Maybe it was that guy. No, that's the nurse. No, maybe that one. I don't know. It's really so fragmented that they not only do they not know their name, they don't even know how they look, because every single day or every week or every month they see somebody in the GP practice, but also in secondary care, it's somebody else. So when we talk about human connection, in any level, the first thing is that we know each other's name. And that was completely removed from current healthcare system, where I almost feel like we ought to start there, as you said, about the communities and bringing it out. So let's have a look at the solution a little bit better. How could you describe your vision maybe for the future of healthcare, that as it is evolving for you in your mind and within your feeling?
So I'll do my best to describe this, only because this vision for me continues to evolve. The more that I learn, the more that I get to see the problems for what they really are, and it continues to evolve. I think currently for me, part of my dream is I want to go back to my hometown. So Newark, New Jersey, it is this sort of gritty, concrete jungle that's really been riddled by like poverty and but there's also a beauty in in that from that place, um, people who literally have nothing have been able to create something out of nothing and influence art, music, entertainment. And so for me, part of my vision and part of my dream is just be able to go into my hometown and like wake up in the morning and have people in my community see me running down the street. Like, oh, hey, Dr. Bautista. And then ultimately have just this authentic relationship to where I'm like, hey, man, come meet me at Lincoln Park. I'll be there tomorrow morning, you know, working out. Come join me. And eventually, like little by little, groups, more and more people just join. And it's not that I'm there providing instruction top down. It's just people joining me and just like us authentically connecting and doing something that's health promoting, right? Or it's like some of my friends in Newark, we have these community gardens that we started. And it's so like, hey, come down to I'll be there at the community garden Sunday doing what I usually do, which is watering the plants, planting new seeds. And it's really us realizing that we need to care for each other and care for the place where we live and just contributing to it. Because that's all an economy is the exchange of goods and services. And it's people who create those goods and services. We get in trouble when we externalize those things to large systems, to large companies, which it really should just be like the people themselves creating services and caring for each other and contributing. And so specifically, how would this look like in a healthcare system? One of my mentors, Dr. Ron Weiss, he built a practice on a farm. And so he grows the food that he quote unquote prescribes for his patients. Right? And in my hometown, what I would like to do is can we show poverty is a problem? So can we create a solution that solves not only poverty, but people's health? So can we create a health promoting economy? So one is, can we teach people how to cultivate food so that they have access to fresh fruits and vegetables, which is a problem in urban communities. B, use that very skill in growing food to be able to provide for themselves. Say that food that they grow, they can then distribute to local restaurants where their friends are the ones that are preparing whole food plant-based meals, right, that then are being consumed by businesses and people in that community, right? Because right now, fast food restaurants predominate where we live currently. And so in creating that shift, right, people start moving away from fast food and start moving towards whole food plant-based meals that are being prepared by the very people that they know. And so now you're starting to create a system in that people are growing and cultivating the food. They're knowing how to prepare it and distribute it. And then you have other folks in the community that are promoting healthy activity, walking, exercise classes, dance classes, yoga, right? And again, the money that I'm making from selling the meals, I'm going to use this and go join so-and-so's class to stay active, you know, and it's all, and that's in an economy, that's what it is. It's like money doesn't stay in one place. It has to continue to circulate, right? But as long as it's going toward things that are meaningful, that are promoting the health of the community, and it's being maintained within the community. Again, these are general ideas. And in my crazy mind, I feel like I can see all the pieces in my hometown. I just hope to be able to be sort of the glue to bring all of these things together, and using my expertise in medicine, be able to say, hey, by doing all of these things, we can this is how we sustain a healthier population, and helping people to do that. I know this sounds silly and far-fetched, but I feel like I can do it. I can see how it can be done, at least in my hometown. And so that's what I hope to do.
That's incredible. It's so empowering to feel the simplicity of it right away. And also that simplicity is what is so empowering for both the patient and the economy as well. So it's almost, you have to be bold to say what is, in a way, basic to human needs nowadays. Because through this huge globalization, we kind of forgot the local empowerment of patients and vice versa, right? So it's almost like we have to go back to nature as it was before, but not, right? But also it's very difficult because we have to account for the global changes, the forces that are what's called economy, really. And what drives that economy to make America what it is. I'm not going to finish that sentence. America, because right now we need more work to be great again. But, you know, let's not go into politics here.
We could probably spend 2 or 3 hours going down that rabbit hole.
Better not, and keep to health. But absolutely, that would be incredible. And I think that's how it is with a vision. You're going forward towards it, and you take 5 steps forward, 2 steps back, but you never stop, right? It's a beautiful flow of growth and empowerment in a way that we never have been able to do before.
So tell me some of the challenges. And I think you mentioned that physicians and healthcare is politicized. And again, in creating a solution for your viewers, it's like, okay, you're in America. This is the situation in the UK. Again, I think we touched upon part of the solution, meaning that it's the community taking it upon themselves, and physicians partnering with people. And this, what you're doing right now, is part of that, right? Because you're not being compensated for this. This came out of your own passion. You're saying, you know what? This information needs to get out to people. How can I be not only an advocate, but also empower people and just and provide this for people? And this is your way of doing that with this platform, with the walks. And really, that's the start, right? It's physicians really just forming authentic connection and partnering and wanting to be a partner with the general public, which is what you're trying to do with your platform right now. But tell me about some of the challenges that you all face there, because I think that's me having a better understanding. Will be able to create a solution that would be applicable to not only you all there in England, but for us here in the US.
That's a cool question. Thank you for that. So what we have found up to now, so we have been running for 1.5 years now. We have been able to refer patients out of emergency care, like 1 o'clock in the morning. Gary came on, the story I started with. And I didn't have the time or the resources to explain to him all about lifestyle medicine, but I ignited his desire to change because I made him feel that it's possible. So referring him into Hero of Health, the platform, the community here, and every Sunday sessions on Zoom, he was able, and then actually listening to your talks like Dr. Sarah Stantic and all the other heroes, doctors who have came on to the show on Sundays free of charge, like you are here right now. Like you don't have to do this. You don't have to spend 2 hours of your time talking to me and sharing this information, but you have done so. And what it created is for Gary to be able to watch these videos and feel at his home that he can do these lifestyle changes. I didn't have to preach to him. He heard it from other patients, how they have used lifestyle medicine and how they have been able to reverse their diseases. This kind of helped him to be able to make those changes in his lifestyle. But then he had a few wobbles. So he was able to come on Sundays, talk to us, chat on the community, on the platform. with other patients. And that kind of led from the pre-contemplation to contemplation to actual action of habitual change. And now after 3 months, he is off of his statins. He's 17 kilos lighter. He is no longer diabetic. Instead of the pre-syncopial episodes and waiting in the waiting room for 15 hours to see me, he's on a holiday right now with his wife, who also took on the changes, So it's super empowering to see that. And even if there's just 1 or 2 patients we can do that with, it's already worth it. So what we find with this platform is that it's very empowering and globalizing. And we hope that we could work on it together, like with you in America, to see how we all can use it. Because this is not UK tool. This is your tool. You are part of it right now. And I hope that you can do whatever you need to do so that the message goes to the patients, because as you said, it's completely free of charge. And yes, I use the salary that I get from putting patients on drugs during my work to get them off drugs on my hobby, which is totally crazy, isn't it? Yes, what do you think? Do you think we could use a platform like this to maybe open up a conversation more in America, make some sessions there, or what do you think?
Absolutely. I mean, that's the beauty of the internet today, is that the internet is also, it's really a platform to exchange information, and it doesn't matter whether you're in Asia, whether you're in Europe. I mean, having access, it doesn't matter where the information is originating from, like, as long as you have access to it. And I think this is where we can start, right? Is exchanging information and ideas. And for and I guess for our audience, the point would be, how can we provide the audience with connection via this platform, right? So that they can connect not only with us, but with their peers, right? And I see Beverly here on the chat, which again, I appreciate her being on today, and we've been exchanging a couple messages, but it's for folks in Beverly's demographic, right? Like, part of the messaging here in the US is that when I'm 65, I'm supposed to have a hip replacement. I'm supposed to feel terrible, feel decrepit, right? And again, part of these platforms is for folks like Beverly to be communicating, say, hey, oh my gosh, I am I'm what, I don't want to even throw a number out there, but let's say, I'm going to say 60, let's say, right? I feel fantastic. I just went on a 6-mile hike. I don't use a walker or a wheelchair. And hey, you can do this too. Or hey, I used to have to use a walker. And in the last 4 years, I've lost 20 kilos. I've improved my mobility. That doesn't have to be the same for you. And it's exchanging that message. So again, that's how we can utilize this kind of platform. But we just need more physicians willing to do so. And you brought up a great point, which is what I call the Robin Hood effect, meaning having to take
I could kiss you right now because you just had the Robin Hood effect. I keep banging on about that. Please finish that. I'm so excited to hear this from you.
In America, some physicians have, similarly to what you're doing, we've had to resort to that as a means to an end. The reality is that an economy exists. There has to be an exchange of value, because ultimately that's what we need to survive, right? The problem is that for lifestyle medicine, for this, there hasn't been an established means for people contributing to this account, to where they can exchange value in order to get lifestyle medicine services. And it's not sustainable for the physician to do so, because there's no structure that exists to do so. So what we've had to resort to doing is working for big healthcare, taking the income and what we get from big healthcare in order to fund our little passion projects. My mentor, Dr. Ronald Weiss, that's what he had to do. He bought this 360-acre farm and started this practice on that farm. And all the operations for the first 5 to 10 years of that farm, to cultivate the land, really, he had to go work for big healthcare, and the money that he made for big healthcare, he poured it into this because ultimately he wanted to make people well. You know, and that's what you have to do, like steal from the rich to give to the poor. So take from big healthcare to create a preventative health promoting healthcare system.
Exactly. I keep saying we need to do the Robin Hood model, and hearing it from you is just everything. Really, you just made my year. It is, we need to take the money from corporations, that are driving our sickness with inflammation, with stress, the economy driven kind of, you shouldn't sleep, you shouldn't eat, take that money and invest it into the more community-led healthcare approach. It's so amazing to hear so many doctors going out there and actually doing what it takes to bring health back into the system, no matter what money it takes, because what is money? Really nothing if you don't have health. It's so empowering to hear that from you. So thank you so much for sharing that.
I just want to briefly comment, because I think Beverly here mentions insurance, and I know that doesn't apply, perhaps doesn't apply to you all there, but on just a small perspective on the American system. So I used to think, again, oh man, insurance companies should be completely advocating for this. Like sick patients that are sick, you can actually treat or reverse your disease. They would spend less money and save more money. Why don't insurance companies want to reimburse for lifestyle services? And what I quickly realized now working out is that insurance, all it is a collective of people that are putting money into a giant pot. And say you have 100 people that are putting money into this pot every month. You only have 2 people that are very, very sick consuming the majority of that pot. Everyone else, for the most part, stays relatively healthy until their time comes down the line, but if now, the reason why insurance companies, I would say, are not incentivized to promote preventative services or lifestyle services for the general broad public is because those 100 people that are putting money into that pot, now, if you have to start taking money out of that pot to fund their gym membership, to fund their culinary class, money is coming out of that pot that wasn't coming out before. And so you're incentivized by saying, hey, these 100 people that are paying into this pot, they'll continue to pay. We don't have to pay for these lifestyle services because we need, and it's okay because we have the money to pay for the 2 people that are very, very, very sick consuming a lot of it. So that's where I think the challenge lies. Again, I didn't go to Harvard. I'm not pretty smart, but when I look at it simplistically and looking at healthcare big picture wise, I can see why it would be unlikely, or I find it unlikely, that insurance companies would want to do that.
I think the insurance problem will always be there. It's a corporation that has all of us part of it in one way or another. Now, you pointed out 2 things really cool. The local empowerment and the global aspect of it. And this is what we have been doing here on Neuro Health, that to be able to touch a lot of people, you need to use technology, and you shouldn't shun it. You should be able to tap into all the tech that can bring this information to as many people as possible. And that's why we are using Zoom and not just going on YouTube and having the podcast, so that your precious time is accessible to all of our patients and our community. Now, but the second thing, there is the local aspect of it. So the global and the local. Now, you are local to your area, right? That means you know your people, you know your community, you understand their unique needs, how they communicate, the language. And I know this more than anyone because I have always been an immigrant. I lived in America, I lived in UK, Ukraine based, so I understand the power of really having that right accent to communicate the right thing at the right time, or the right energy, because energy, I feel, transcends all. But coming back to the local aspect of things, I mean, if a Yorkshire man listens to me, then that means something had to go right, and it's definitely not my accent. So there has to be something. So I would say the local aspect I find is crucial. And this is why we started the Hero of Health walks, particularly so that we can bring those conversations together in one place, but we can tap into the knowledge of amazing doctors like you. So people from here in Burley Health Center who come on the walks, they can come on the platform and talk to you and listen to you and actually re-listen what you're saying from America. And this way we have that community aspect of the fact that, Peter, who is 80 years old, and he has known the father of one of the patients who is now 50 years old and sharing his mental health issues. And he's like, yeah, I actually knew your father. That is so powerful that nothing can transcend that, right? So now that they are like communicating and empowered, now they have to tap into the knowledge that we are hopefully are trying to provide here on the platform. But what are your thoughts between this global and local power?
Sort of like we mentioned early on, it's so powerful that we can use technology now, and the distribution of information isn't limited to where you're located geographically, right? So like I said, having that conversation with Erica was so insightful. And again, hopefully the hope is that hypertension is hypertension, whether you're in China, whether you're in England, whether you're in the US, and having to overcome, hey, a problem like food scarcity. Hey, I'm trying to eat healthier, but I have limited income. That problem, you can feel it in England, you can feel it in China, you can feel it in the US. So it's, and it's sharing solutions. And that's why when like I said, my mentor, like Dr. Weiss and Dr. Stancic, when they would get their patients together, a lot of times the patients would problem solve for each other, and through exchanging their struggles, like they'd present it to Dr. Weiss or Dr. Stancic, and another patient would chime in. I was like, oh, hey, I was experiencing the same problem. This is what I did. And there would just be this energy and exchange of information and flow. And that's what these platforms can be used, is that someone who is across the world, and maybe you can all communicate in a limited way, perhaps, still be able to exchange ideas and solutions. And that's the power of your platform, I believe.
This is something very interesting you just said. I often talk about segregation of our body parts. So cardiology, gastroenterology, mental health. I mean, that is completely segregated. It's not even medicine almost. It's not even. So the problem is segregation of our physiology, and then having them treated by different specialists, and the problem of segregation of patients from each other, so they cannot communicate. It's almost as if we have set the whole thing up for failure, knowing too well that we are social animals, which means that we communicate information and translate that through our mind between different minds, right? So we don't stand alone with an idea. We constantly need somebody to kind of digest some of that information and hand it over to us. We think about it some more, and then through generations, we are able to come to some conclusion that is fitting to our problem now. And you just highlighted that, and you really verbalized it so well, that the patients are solving each other's problems, and it's almost like we become just shadows in the background as doctors, and no longer are we preaching, but we are kind of just guiding like teachers and philosophers like we were in the past. What do you think about that?
Oh, You just said things that resonated so much with me because you talked about someone taking information, digesting, interpreting it, and then putting it out. And that's ultimately what the physician, that's our role is. We take this information that may seem complex, we interpret it and digest it and then put it out into the public. And then the public sort of takes this sort of like digested information and molds it and shapes it and they exchange it. And that's, I completely agree with you. That's supposed to be our role, is to serve as almost as a facilitator. I think in the future is just facilitate and the community and just help the community to create, shape, and mold the solutions that they feel they need with our guidance. And that's really what it is.
Yes, you just said it. Finally, that bit where what one of our patients on the walk said, oh, I've been to diet groups and this group and that group. And it always felt, or talking to my physicians, I always feel like I'm serving their goal. Like I need to stand on that scale and lose that weight, or I need to fulfill my doctor's needs because he said to me to do so. But it's never about that, my belief of what I need. So the first time she was like, for the first time in this group, I feel like we are actually addressing what I need and I'm serving my needs. So you're taking that kind of information on and allowing that to regurgitate that into their own lifestyle, into their own mindset within the moment that they are living. And every single week, that moment is different. Every week, the same person with the same background, medical history needs something else, right? It's very fluid in what we are and how we are changing. And one day we're up and within the same day we're down, and it's completely normal. And that's why lifestyle medicine should be so fitting for the person within that socioeconomic background in which they lived, within the accent, the language, within the physical constraints or positives that they are having. So we cannot just isolate patients into a disease and treat that with one single pill. And I think that's where we are really having problems with the current healthcare, if you're not supplementing it with the community within which we practice.
Oh, you hit the nail on the head, which is that we try to take this generalized approach and sort of one size fits all. And we talked about global to the local. And to be really effective, like you said, people at the individual level, they're always changing and evolving, and who you are one year is not who you're going to be next year. So you can't take a one size fits all approach to someone who is not the same and is constantly evolving. To your point, again, and this is very important, which is why, again, we need to hone in on this. The local needs of a community, when you're applying a solution, you have to take into account the local needs and the local culture, philosophy of a population. Like again, in my hometown of Newark, New Jersey, dance is a very strong part of the culture. If I told someone in Newark, New Jersey, hey, come out this Sunday, do some goat yoga, they're going to look at me with like I'm crazy, and they're never going to show up. However, if we create like a dance fitness type of activity, man, again, and I love, there's this woman who took it upon herself. It started with just her and 5 of her friends would go out to the park and dance and as a way of fitness. And now you go to the park and it's 100 women. And like, that's what's powerful, is that you have to take into account, but that works in my hometown because dance is part of, like, if you grow up in Newark, New Jersey, like house music, Jersey club music, that's what gets you going. That's a part of the fabric of Newark, right? And that's what gets people moving. And if you understand that, I'm more inclined to get people to be physically active by creating an intervention that incorporates that understanding. Again.
So I'm so coming to New York. That sounds amazing.
But to your point, you have to understand what the culture at a local level, and it's really hard to apply a generalized nationalized solution when the culture in one part of the country is very different from another.
Even within 50, like even within counties, like, so just for example, here within Sheffield and Rotherham, as you mentioned, the difference is so important to get to those people, and through their mindsets, you have to address and appreciate and respect the differences. And but those differences are also what drives the health inequality as well. So here, just across a road between Sheffield and Rotherham, where I work on the more poor side of the area. There is a 17-year life expectancy difference. So just across the road, literally between, there's just a 5-minute drive. People will live 17 years less because of health inequality that is within this actually commerce-driven healthcare. Even though it doesn't sound like it, it is still politicized, it is still money-driven, and everything is done in the background. So because of that, we have social differences, and we have health inequality, which we have been fighting here on this platform so much. And why it is free of charge? Because that cannot be that our patients who make us laugh, who we love so much, who cheer us on and come and, bring us tea, like this person on a local level, that they're going to live 17 years less just because they were born in the wrong place. I mean, how could we allow this to happen as physicians, right? But that local difference is what we need to tap in with respect and make it as a forefront to our care, I think, as you just said. It's an amazing observation.
Yeah. And again, I just want, I just want to thank you for doing that. What you're doing is incredibly difficult. Having seen my mentor, Dr. Ronald Weiss, Dr. Stancic, again, try to start these practices, these independent practices, independent of the healthcare system, independent of an insurer, and really just go at it alone. And what you're doing now, again, with this platform and funding it yourself, my hope is, and sort of where, again, perhaps I'm a bit of an idealist. My colleagues think that I am crazy for choosing not to be employed once I finish my training this year. And as terrifying as that is, I'm doing it because there's a part of me that's hopeful that when you generate value for people, people naturally gravitate towards things that provide them with value. And so, yeah, I think that in the future, yes, you're doing the Robin Hood thing, working for big healthcare in order to fund this platform for free. My hope is that in the future, the funds that are being diverted to these to big healthcare would be diverted to these platforms, to lifestyle medicine physicians, just because naturally people see the value in it and the value proposition in it. And again, it's not about money, because definitely I know you and I don't definitely do this for that. But our hope is that, again, we'll be able to grow these platforms and actually be able to provide, not only provide for ourselves, but be able to continue to provide greater tools for the general public. Right, man. Part of my dream is like, hey, like my dream practice is like, I'll have the practice, but it'll be kind of like a large community center where people can come, they can spend the Sunday afternoon, socialize with each other. If they want to go exchange and exercise, they can, as part of a fitness facility. If they want to eat lunch, there's like a little plant-based restaurant where they can share a meal with their friends and family. If they want to take a culinary class and work with a plant-based chef and learn how to prepare plant-based meals, they can do it in the teaching kitchen and get lessons, and and then if they want to go and learn how to cultivate food, they can go on the rooftop or on the plot of land that's right next to the side and go work with our farmers and learn how to grow food, learn how to cultivate food. And that, and again, that's not that they have to pay $150 or whatever amount to be able to partake in those experiences, but that those experiences are part of their quote unquote healthcare, as ridiculous as that sounds, right?
Okay, wait. So let's put it out into the universe now. So you're graduating in 1 year, yeah?
Yes.
And what is the next physical step to open the dream clinic where when I'm a patient, I'm gonna fly there just to see Dr. Saul, okay? So how can I find you, and what will be the first thing that you're doing so that we can actually find you? And what can we ask for from the universe to bring to you, basically? What do you think you need to start with that?
Well, I think the first thing towards that is just connecting, really. Again, for me, I'm going to go back to my hometown, and the first thing I'm going to start doing is, remember that woman that I told you about, that she goes to the park and has like 80 to 100 women that are there? I'm going to be there, and I'm going to be participating in that same class, being physically active. And all I want to do is be able to take this information on how exercise and being physically active, how it impacts disease, and how you can, and how by doing that very thing mitigates your disease, and just sharing that, sharing that and say, hey, if you need a little bit more specialized sort of like one-on-one time, come see me. I'm happy to give it to you. But really, I just want to share and spend that time with people and provide information that typically they don't have access to. And that's really all I want to do. And whether that's, like I mentioned to you earlier, working with me in the community garden, or sharing that space, or sharing that space in that woman's free exercise classes, whatever that may be. So
okay, we need to make sure that you're sustainable so that you can be there forever serving your community, because we need you more than anything. Our patients need you. So what will be, from an insurance point of view, if the patients come and join, how are they going to have to pay for it? What do you think in this crazy world of money?
And I'm not going to pretend and say that I have all the answers.
No, just an interesting, like,
part of what I've been exploring and trying to figure out is that, one, is there a way that I can support myself outside of medicine? Or B, if that were the case, can it be community owned? Meaning that the community is basically all those services that I mentioned, they're not owned by me. What the community pays for them, and they're owned by the community. I'm just there as a facilitator. And so I don't own it. All that money that's being invested doesn't come to me, and I'm the one creating it. It's more so that all of that is being invested into this entity, and the entity is owned by the people that's investing in it themselves. And again, and it's regulated by a board that's made up of the people in that community. Again, I'm just there really as like a facilitator, someone with a level of expertise that can maybe help inform decisions as to what I think should fit and how it fits. Again, that's kind of the idea that I'm exploring, exactly how concretely that is. Again, it's sort of evolving. Because again, everyone is trying to figure out, how do we pay for healthcare? How do we do this better? That's a potential solution that I'm exploring, because part of the problem is that it's a commercial entity owned by a company, a figure. And it's like, and I think there's conflicts of interest with that, but it's different if it's owned by the people themselves, because the people are invested because it's like, this thing is providing me with value and I'm a stakeholder. and I'm investing in it.
That is brilliant. That is just beautiful. And anything that we can do on a platform to share your message as it's evolving to get, it will be Newark, right?
Newark, New Jersey.
Newark, New Jersey. So to get all the people in Newark your way, their energy, their positive way of approaching this, we need to get all the people with money to go out there to invest into the community. And I hope that with time, as you're saying it out loud, I truly believe, as you said, when people know that you're coming with good intention, it is repaid 100 times and the solutions will come. And this is exactly why we have renamed this Hero of Health, because you are the hero of health. You are actually sacrificing your really lucrative private practice opportunity in America. Come on, ka-ching. Any doctor will be like out there seeing the dollar sign. It's very hard to say no to. But what you're doing, not only that from the beginning you're not going in, which gives you an opportunity not to sell your dreams, right? Once you're in the system, I feel it becomes very difficult to come out of it. But if you start from the beginning, then it's very much harder to actually create something, maybe because there's a lot of weight. You need to pay back your really expensive education. I mean, the bills in America are huge. There's no question why the salary has to be so high, right? You have to pay back that. And on top of it, you are going out of your way and becoming the hero of your community, leading by example. And I really can't wait to see your community center where you're healing diseases, preventing and reversing one after another. It's so exciting. What will be the first, where will be the place where you would like that to start? Just even if it's not for sure, but what is your vision? Where would it be really cool for you? Just to put it out there.
Man, I would love it to be somewhere in downtown. I'm just the heart of the city. And sometimes I struggle because there's a part of me that thinks about it realistically, like, okay, tries to adapt. But then again, now that we're you're having me explore what would be my dream, I've never thought about it because I never thought about taking away the limitations from, and maybe that's what I need to do, right? Think about my dream dream plot of land within the city to do so, to really execute the vision the way I feel it needs to be done. Thanks for that, Linda.
You know why? Because once you have a real location, you know what's in the location in your mind? When you have the location, you have people within that location. And within that, you start creating the network, the bonds, the energy starts arising. I think you're way down the line. You're way on your way to making this real. I mean, there's no question that this is going to happen. I think the next step is walk into that location where you want it to be and manifest it in your mind. It's going to happen, like one step at a time. We started the same with the Burley Health Center. We found, we just wanted to have one place where we ignite the energy. We bring that health to the local people. And what happened? The local people started looking for a kitchen for us. We didn't even ask for it. They're like, we need to learn how to cook. So now they found the community center where they want to cook with us. After, they want to, next week, we are going to have picnic together. All of us, they found a place, they're bringing the food, and the energy is just building, and all you need is that place. And I can't wait to see where it is because we need you.
I love that because you touched upon exactly my sentiments, which is that the people themselves take ownership of it and then they'll go ahead and execute. And again, like you said, they knew that a kitchen would be of value to them. I mean, we know it's a value. We know that right? But they felt that it was of value to them, and they went out of their way and they facilitated it. And it's at the end of the day, it's for them, it belongs to them. And that example was perfect.
And it's happening. It's you can do it, man. It's incredible. The other point to that, just to keep in mind for your energy, that it's going to happen, is that once there's a question always about the diabetic. I don't know if you guys have these diabetic prevention programs. We have one here. Well, the retention rate of this course is, you could guess how much it is.
I would presume if it's driven by a central healthcare entity, it's probably on the lower end.
Yes, it's 13 to 17% if you're lucky. That just the retention of our patients to help them change their lifestyle for diabetes reversal, and it's 9 months long. So they always ask us when we start to talk about this, they ask, so what is your retention rate? I mean, we are growing so fast that we can't stop. We actually have to start limiting it, because it's no longer about the disease, but as you are doing it, as you're envisioning it, it's about the people. And you are so on the dot there. You're an amazing doctor. You're the hero of health in Newark, New Jersey. And I cannot wait to see your community grow. Thank you so much. I am so conscious of the time, but before, just to bring the spirit up to show how much is possible with your vision, I want to celebrate Beverly, who has been with us for a while. Hi, Beverly, would you like to come on? If you put your mic on. Beverly is amazing. She has been taking lifestyle changes on in a very, you're still mute. Oh, sorry. Maybe I have to unmute you. Yes, technology.
Okay.
Awesome. Yes, Beverly sorry, Beverly, if I share this, it's all about this speedy approach nowadays, how we expect things to happen really fast. Beverly wanted her blood pressure to come down with lifestyle medicine approach and a whole food plant-based diet. And I think, Beverly, after 6 weeks, you were a little bit frustrated that nothing happened immediately, right?
Yes.
Yes, and we had to kind of remind Beverly that lifestyle changes, just like it has taken a long time to develop the blood pressure, it also takes a little longer, up to at least 3 months, to get the blood pressure down. So we want to celebrate you, Beverly, the hero of your own health, for getting your blood pressure down by being patient and applying to lifestyle changes. How are you feeling?
I'm feeling great. And one of the things that really struck me was the idea of having people interested in what you're doing and how much of a big difference that makes. Because the other part of what I've been trying to do is lose weight. And so even though I've been really good with my diet, I'm eating more than I should, or I was. And what's been interesting to me is over the past week, my husband had been expressing increasing awareness and concern to me, saying, I like you the way you are, but I know that you would be happier and healthier if you were losing more weight. And now, like when I'm going to go to the refrigerator or whatever, I kind of hear him in my head and I go, oh no, I don't need to do that. And it also reminds me of when I was a kid. If I was getting a B, my father would act like, I was a failure. And, it's like, what are you doing? And so, of course, when I got to take chemistry in high school, and my father has a degree in biochemistry, he had, and he taught medical school, I was failing chemistry. And the teacher calls me into his office and he looks at me and he says, why are you doing this? And I knew at that moment that he cared. And I just walked out. I didn't really have an answer, but I walked out, and after that, I got straight A's in chemistry. Because he cared about me. It wasn't that he was caring about me as a grade machine, So it's such an important thing to know that someone is aware of you and that they have good wishes for you. That's all I have to say.
That's so beautiful, Beverly. It's incredible. Not only that you have just highlighted the importance of care, which is what Dr. Saul is bringing to his community. Yeah. Before we were treating our patients with medicine, and Dr. Saul is treating them with care, love, and hope. And that's why the community that you're going to grow, both of you, I would like to celebrate you as hero physician and hero patient right now, because you're making that change that we need to see in this world. And I truly believe that the more we are, one by one, we are going to inspire. Beverly, you're inspiring your community. One by one, everybody is hearing about your successes. And Dr. Saul, you're inspiring not only your physicians, but your patients. And together, you will make a better, we can actually crush all those systematic beliefs that everybody is turning on all the time. We can do it because of this and that. You guys are going outside of that and saying that you can. So let's celebrate. Let's share some love.
Thank you. Well, I want to say, can I say one more thing? One more success. I think you knew that I had been whining for a while about the fact that my diabetic son was resistant,
yes, for a long time, over a year that we have been talking about that.
And my husband, who, by the way, when he was a little boy, he lived in Newark, New Jersey. When you said Lincoln Park, I went, oh, wow. So anyway, my husband has been posting pictures of the things I make for him, every single meal practically, on Facebook. And now my son came to me and said, Mom, you should do a cookbook. You should make recipes. He says, if you send me recipes, I will make them and eat them.
Wow. Whoa, you got through to him.
I was so excited about that. So
Beverly, thanks for sharing that, and again, you're spot on. It's about just us connecting, and like you said, knowing that the person you're entrusting with your care actually cares about you. And then B, just a story about you finally sort of like were able to, in a roundabout way, like influence your son. I'm sure you were probably telling him and sending him messages, and it took him a while to kind of come around in his own way by like wanting to like sort of like have the food that you've kind of been posting. And I tell my patients all the time, I'm like, you're going to do more to impact the people around you than I ever will. And that's a prime example of really how the community is going to be taking care of themselves, And
yeah, and where he was before, every time I'd send him some information, a YouTube, anything about health, his response was, stop sending me propaganda. I mean, he was angry. He's like, I don't want to hear, I'm going to block you if you keep sending me this crap.
And you got through to him. This is just a great example of how we have to continue on. Now, amazing. Thank you so much, Beverly. You're the hero health patient today. Keep on going. We really care about how you're doing, as you know, and share with your family and friends your health. It's infectious. Dr. Saul, thank you so much. Dr. Saul, where can our amazing patients and our community find you right now so that they can follow your incredible work?
So on social media, you can find me, my handle on Instagram particularly is saul.j.bautista. And then on Facebook, it's Saul Bautista as well.
It's actually a really cool name. Amazing. So if you guys want to check it out, support this incredible vision for the future, just please follow, share his incredible vision. And I know that this is going to happen. I can't wait to hear where the location is. Maybe you can share it in the community. the picture of it, where you see this coming to life. And I'm pretty sure in no time, all the community will come together to support your work. Thank you so much for coming and sharing your vision, your passion, your energy. This has been very special for me personally, and I hope for everybody who has been listening. Now, after this session, we are going to go off just for a little longer on Zoom, where everybody can have a little bit of a chat with you, if that's all right. And if you haven't followed us on Instagram yet, you can go on Hero of Health, and as well as you can join our members area, heroofhealth.com, which is completely free of charge to continue this conversation. And if you have any questions, you can do so there. So thank you very much for joining us today once again. We'll see you next Sunday. Thanks.